I am Dr. Vijaybhaskar, Masters in Orthopedics. How to improve the bone density in the children? The density in the bone is most important with the mother nutrition, because whatever she feeds is sufficient to support the body growth as well as the bone strength. So what is bone? A bone is a structure in the body which composition of vitamin D, calcium, minerals and vitamins which obviously strengthen the bone. The children bones are flexible, thicker, with a thick periosteum on the cortex of the bone, which is bears and supports the human skeleton, where even there is a big thrust to the bone will break like a green stick. So obviously when there is a malnutrition, the children is not supported properly from the birth during the child age, considered to be 1 to 14 years. During that age, they should get the balanced diet, nutritional diet. Hence, there would be good life to go ahead in the future. When there is a decrease in the nutrition, when there is a deficit in the nutrition, obviously, because of vitamin D deficiency, calcium deficiency and mineral deficiency, the child will suffer from malnutrition disease called rickettsia, where the knee joint in X-ray shows the variability of growth bone and subchondral bone. Obviously, we must know that the children's bone density to be well maintained, so that they should not get into a trouble or they should not get into a diseased bone. So, in bone density, the bone densitometry will show you whether it is osteopenic or not. If they are osteopenic, their vitamin D3 levels are less, and then where there is a calcium levels are less. Obviously, we need to supplement weekly dose of vitamin D, cholecalciferol, daily supplementation of calcium at least 250 to 500 milligrams, and lot of green vegetables, green salads, and balanced carbohydrate, protein and fat. Obviously, the children needs to expose to the sun with larger area skin exposed to the sun, so that the much amount of cholecalciferol will be absorbed through the skin. Anyway, the bone densitometry or bone density of the children is the most important for the future, because their daily activities, sports activities, and then any other thing what they wish to do. Thank you.